My father was a doctor, and my father was always my hero. We were brought up very early in our lives. Don't think because your dad's a doctor, you're supposed to be a doctor. When we were little kids, we were told that, and I admired my parents for saying that to us. Well, I wanted to be. Since I was 7 years old, I wanted to go into community medicine immediately after I finished my residency. I started at a community center 1 month after I completed my residency.
I came to the health center 29 years ago on a National Health Service scholarship. I did my 4 years obligation, and then I have been at the health center ever since. I think when I came to the health center, I did not expect that I would stay beyond the 4 years, and it's just such incredibly rewarding work, and the patients really kept me there because they're so grateful.
My start here at the Star Oaks Health Center was providential. As a Catholic priest, you go pretty much where the bishop asks you to go. And so the bishop called me and asked if I'd be interested in coming down and helping to run the place. I figured I'd be here for a couple years and move on, but I've been here for 40 years, which has been a wonderful experience for me.
When I went out to the centers and saw the mission that the organization was providing, I said, this is something I like to do. I bought into the mission of providing service to the individuals that needed it, and I really didn't understand rural health at that time when I first started, and over the years I've become to appreciate what our providers and staff provide to the community, and I bought into it.
Well, when I started, it was a converted barn, and I'm not very good on square footage, but I'd say it was maybe a couple thousand square foot at the most.
Picture this. You could actually be sitting in a dental chair or your exam room and look out stained glass windows, actually in a former Catholic church.
First location was in a larger community service organization in Farrell, PA, and the staff was 3.5 people. Myself, a physician, a nurse, and a half person that was shared between Shenango Valley Primary Health Care Center and the social service organization. We shared everything. That's where I learned how to be a partner.
I remember looking at the pediatric space. It was in 2 sections, and adult was on one side and pediatrics was on the other. And I was walking through, when I went into the pediatric section, they had shower curtains hanging for doors. And I remember looking at that, and I was a little mortified, and I thought, okay, I don't know if I can really build a health center, but I certainly can do something about those shower curtains. And that was my defining moment for deciding to come to Philadelphia and try to build a facility that would take the organization into the future and expand services for the community we served.
Oh, it changed dramatically. Back during that time, Philadelphia had 3 medical schools, a number of hospitals, and this was a new idea of ambulatory care. They didn't even call it ambulatory care at the time. As a matter of fact, we were looked down upon, community health centers, and in the healthcare community in Philadelphia, they used to call it storefront medicine, and no respectable doctor would ever work there. And that's how we got started. When I came, we went from 1,300 patients at the time. Today, we have 8 centers. We're serving 85,000 patients.
They had really gone through a transition. And so it was a point of trying to take and change the image. I changed some staff, I kept the majority of it, recruiting doctors and other people who wanted to come there to work. And so it was more or less getting the name of the organization back intact, of saying to a point of, we provide good care, this is who we are, and we want you to come here for our services.
Our grants grew. People wanted health care. They truly didn't have it. We focused very strongly on community in all the permutations of that word. One of my most interesting memories is being in a coat and tie wanting to know where homeless people slept and climbing down under a bridge with a homeless outreach worker. He decided I didn't know enough and he was going to teach me, and he did.
One thing after another, we went from Mercer to Lawrence County, pretty much the same formula. We would be invited to go somewhere, and we made sure we had a provider at that new area and some funding available so we would just be able to grow wisely, strategically and smartly.
A lot of people ask, why aren't you in Wilkes-Barre? And we said, well, because there's too many other providers, and the criteria was they added up all the providers in the area. They threw pediatrics, OB, everybody in as a family practice site. And when they added the numbers up, we didn't qualify.
But it's mostly finance. It's always finance that's the biggest barrier. And in rural settings, recruitment of physicians has always been a problem for us.
Because we were serving a lot of uninsured, probably 30 to 40% were uninsured, and a lot of people on medical assistance. And when we started, we were not a federally qualified health center. So medical assistance for non-FQHCs is one of the worst payers. So there were big financial barriers to keeping the doors open.
Finances, personnel, the environment, and I guess, to be honest, the drug wars that come and go. Sometimes the drugs are very active in a town like this, and sometimes they sort of abate a bit. So that's always a challenge.
Many times in rural communities, people become rugged individualists, and they're a little bit out of touch with what's happening throughout the world. I know that's changed significantly in the past 10 or 15 years, but people can be unwelcoming. And sometimes if people are a different color, speak a different language, we don't understand them. And many times we think we don't like what we don't understand. So I think there was tremendous bigotry in this community.
Many of the barriers I faced, and the challenges, I'll call them, because they were things that could be overcome but took some time, effort, and some good fortune, they still exist. When I started there, I was right out of residency, and we had a challenge meeting our expenses through the revenue we would generate, billing in a compassionate way. By that I mean we understood some people couldn't afford to pay us. We were surely not going to give them care. So the challenges of making the resources meet the responsibilities of the practice were there then, and here we are, fast forward 34 years, they're still here. We have the same kind of challenges stretching. Yes, we have more staff than we once did, we have a bigger budget than we once did, but we still have the same pressures in helping the resources and the funds that we get provide an increasing palette of services to our patients. We still find that in our community at large, a lot of folks don't know what we do. They don't understand we provide the degree and the quality of healthcare that we do with the quality of staff that we have, and also that we are there for everyone.
If I knew then what I knew now, I think we would have developed our business model sooner. And I think it was going to be important that we grow, not to brag or not to. The reason for the growth for us was really twofold. Number one, the acute need. We recognized the need and we went to meet that need. And the other is the recognition that the larger you become, perhaps the more influence you can have over the industry that you serve.
I probably would not have stayed at one place so long. I think what happens is you get in a place and you become so attached. The community, I had no problem being attached there. But sometimes with the people you work with, where sometimes you should make changes that you don't because of circumstances, because you know this, you become attached in so many ways.
I would have worked with more community agencies. I would have attempted more training and development of my staff. I would have, frankly, attempted more training and development of me. And I would have tried to develop a stronger strategic thinking and planning.
You know, I don't know if I would do anything different. I think we all have one goal, and that's to serve the underserved. And you do what you have to do that, and that's a changing environment, and you just try to do your best to change with it so you can continue serving the underserved.
Have a passion for service, because at the end of the day, we will never have the level of resource required to meet the needs of those we serve. So you have to be able and willing to take what you have and make it work for you.
Well, you have to be dedicated. I mean, in the community health centers, you have to be dedicated. And if you're not, I don't think you're going to make it. It's a lot of hard work, and the finances maybe is not there like it would be in the private world.
Follow your passion, you know, and I think for health center leaders, their passion is serving the underserved and really kind of think outside the box or dream about programs that you might not have, and then try to tap into all the resources that are there to help you make that happen.
I think that our communities lose the best of minds because people see the work being too hard to come to the community. And I would say that if you really want to give back something, then this is where you would come to bring your skills and learn. It becomes very important that nonprofits in the community continue to have good leadership. And that leadership can only happen if people can bring it to the community and understand how it works and have that kind of commitment. I see too many people who don't have that commitment, who think it's an easy job until they get there and they get their butts kicked.
You have to have a lot of energy in this field anymore. The healthcare industry is fast-paced, constant changes. You have to be out networking with people. You need to go to conferences to hear what's going on, and to other locations.
People don't change really over their lifetime. The world goes on, some of us live, some die, we have new people, but guess what? We all need and want the same things. Nobody cares how much you know, how smart you are, how good you are with your computer, how many computers you can work at one time, till they know how much you care about them.
Well, the excitement, I think, is the fact that our country is finally coming to grips with the reality that before affordable health care, we had 45, 50 million people without health care. And now a large dent has been put into that population, but I think people are beginning to understand that there can be systems and processes developed to approach those folks without health care. And I think more and more people are beginning to understand that and to get on board of trying to make a difference in that process.
As we continue to learn from one another, support one another, as we grow, as we begin to really have an impact on the health care of our citizens, you know, whether they're poor or not, I think that's the exciting part.
Trying to get the quality up that I hope in my time I see the meaning of meaningful use, see the meaning of all these clinical measures, that the quality for the patients are better, all the preventive care that they're talking about. I hope that works and we're a healthier group of people.
I believe for our patients, or for the healthcare delivery system as a whole, it will be a better system 5 years from now. I mean, we are going through the challenges now to make that happen, but you know, in the near future, I believe it will be a better system, and our patients overall will receive better care.
I believe that because of the fact that all the money that the federal government has put into community health center, the expansion, even with the Bush administration, the Obama administration, there is a big plan out there, and I think federally qualified health centers are part of that plan. I think it's going to be exciting times for us all.
I'm very excited about the entire FQHC movement because I believe that's the best delivery model in the whole country, and I believe that this model will save our country. I truly believe that. because we provide health care to anyone and everyone, regardless of their ability to pay.
Health centers are growing. They are trying to become larger organizations that retain that mission sense, yet manage financially effectively as well.
I'm excited that the Affordable Care Act is here to stay. We pushed for it, we're a big proponent of it. I mean, now we're able to justify our continued existence and growth and have the opportunity to provide access to patients, more patients. I mean, and we're the cornerstone of we're the future of healthcare in terms of primary care.
We are, I think, increasingly becoming known as providers of choice, and that we really provide quality health care to all, regardless of ability to pay. That we're not the place to go when I don't have any other options, but they're the place that a person would go to because they're going to get great care there. And I think the data continues to prove that that's the case, and the message is being spread more and more.
To me, this has always been a movement. It has been a movement because it's a change. I mean, when you look at what Reed Ryan does in Stowe Rocks, it wasn't just a health center. It was a whole thing that the community needed, that he was always willing to step in and take a leadership role and make changes. And that's why I've always seen it as a movement.
Yes, we are a business, and that's important because we've got to be able to meet our financial obligations. But we should never forget that we are serving and trying to make a difference in the life of someone that ultimately will be able to give back to their family in their community.
Healthcare is moving fast. The rules are changing. More and more folks outside of our direct catchment area are looking at what we do, second guessing how we do it, telling us how we ought to be doing it. The measure of success is like a moving target. But even in that arena, I love the fact that as all that dust settles, we're still making a difference to patients. There's still a person who is taking better care of themselves, has a better chance to live the life they want to live, doing the things they want to do because we're here. And that's energizing to me. The system can be moving. Fine, it's moving, it's swinging here, there, and everywhere. We will swing with it. But the joy of swinging with it is not destabilizing and making me think how terrible, I can't wait to get out. It's energizing, making me think, although we're on this roller coaster ride, where this roller coaster is going is great.